So, Julia, you started your essay with talking about the idea of giving bad news.
Mm,
If I might read a little bit because it really inspired me and I relate to it. You wrote, "I dread telling someone that they have cancer in the emergency department. It's always hard. The walls are an odd pale yellow. The bed is uncomfortable. All is illuminated in harsh fluorescence." And then you wrote, "I try to soften it. I shut off the wall switch and turn on the warmer procedure light. You sit. I speak slowly, quietly. My phone rings. I silence it, but it rings again. And then you have to leave the room."
mhm,
You had shared something that is really moved me this or earlier in this conversation, which is he was a witness to suffering, your dad, and we witness suffering all the time in our
mhm.
work. So I'm wondering if you could talk a little bit about that, about uh, what about the witness of suffering and what you learned from your dad
Mhm.
around that um, helps you be a human. And because that initial discussion is so vivid. It's real. It's almost an inhumane environment that we have to give
Mhm.
bad news
Mhm.
around, but yet we're forced to do it, and then we're torn in different directions. We have a patient in room 9 and a patient in room 18, and the nurse is calling us, and bells and whistles are going off all the time. So, can you share a little bit about this idea of being a witness to suffering and what your dad taught you about that?
It's strange work that we do, right? Um, we we are privileged to enter into these, like, the worst days of people's lives often, right? I don't know, I've told a lot of parents their kid has had cancer over the last 15 years, right? I'm sure you have too. That being just one example of, and it's often unexpected, right? They usually don't come in thinking that's what's going on. And we have to, and we've just met, right? I don't usually have a relationship with them. So it's very particular, I think, in our world of the emergency department. We're seeing these sort of sudden traumatic events that we're a part of, right? We're either helping take, well, I mean, we're helping take care of the person, right? Which is sort of the, I mean, we are able to do good often, but sometimes, I mean, like with that instance, right? We're sort of giving people news and then handing them off to another care team that's going to be with them, and we're having to tell them something so devastating with very little relationship or warning. And exactly, like, I've always thought about that. The ED is, it's even in the pediatric ED where we, like, really, I think, try to make it cuter and nicer. It's like, it's a pretty, like, unpleasant environment. I mean, it's very technical. It's very, it has to be sanitary and all these other things, right? And it's not like you're in a therapist office where there's like a nice couch or things. So how do we sort of create a relationship quickly? How do we create a sense of safety? And how do we sort of, yeah, try to soften that news? And then how does it affect us as we watch this family go through this? Like, I think it's just really, really hard. And I know we talk about giving bad news in med school, and we learn we learn about it, and we learn the right things to say, and that can be helpful. And we have our colleagues in palliative care who I think are just amazing at this, and teach us every day how to do it better. But just sometimes it's like ripping off the Band-Aid. Like, it's there, you can't always make it so much better, and there is gonna be suffering, and part of that is what we can feel like we're creating it, right? Like, I'm the one telling you this terrible test result that means this. Like,
Hmm.
I can't change that. So, I think what I've learned most from my dad is a lot of witnessing is being and not doing, right? Like, I always think about that tension we have in our practice. Like, we're doers, right? We're like, we're gonna order the test, we're gonna, like, think about our differential, we're gonna use our brains, we're gonna use our training, we're gonna try and figure out what we can do, right? We're gonna diagnose you, we're gonna treat you, we're gonna suture your wound, or we're gonna set your broken bone. A lot of those doing things are more simple, but sometimes we just have to be, I think. Um,
And when
so
you
I'm
say be, you mean just be present.
be present,
Just
be with,
listen and
be
just
amidst, right? Like,
mhm.
and recognize like we are all human, we are all vulnerable. Like this could happen to me too. This could happen to my child. So how do I sit with someone? I think of like the great practice of sitting Shiva, in Judaism with that's like a lot of it is sitting, right? Like it's being, it's eating, right? Eating is important, I think.
A lot
I
of
grew up,
eating.
I grew up around like Jews, Italians, and Mexicans mostly, and like the power of food, right? Like in grief and in suffering is I think missing in some in some other cultures. Like, and I very appreciate that, right? I don't bring in, the bob cut to the ED exam room with the leukemia diagnosis, but sometimes I wish I could, right? Like I bring Gatorade and goldfish like when I can, right? But so I've found that after speaking the words, like time and some silence, and sometimes if it's appropriate, like some hand holding or some, hand on a knee or some, I don't know, that time is important. It's also weird to get that news. I've gotten that news personally, like, I've gotten a cancer diagnosis personally, and what your brain does in that moment is very strange, and everyone has a different experience, but I having talked to a lot of people who've gone through this, right, it's time becomes very strange and surreal, and it's hard to sort of there's sort of a shock moment and sometimes like, you feel like in Charlie Brown when the adults talk that like, "Rah, rah, 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 rah." So I think some time also and sitting with give some space for that to sort of settle.